Welcome back to our mini-series on healthcare. Today we are going to look at the case study of a 55-year-old female who complains of chest pain while she's at home. Her blood pressure is 129/58, heart rate 32, and her respiratory rate is 34. What is happening to this client? Clearly, the individual is suffering from low heart rate, a condition referred to as bradycardia. At the same time, she may be suffering from a heart attack, and her elevated respiratory rate may be attributed to the pain and discomfort that she's feeling. What is bradycardia? Bradycardia is a slow heart rate. The hearts of adults at rest usually beat between 100 and 60 times per minute. If you have bradycardia, however, your heartbeat will be fewer than 60 times a minute. Bradycardia can be a serious problem. If the heart rate is very slow and your heart can't pump enough oxygen-rich blood to the body, if this happens, you could feel dizzy, very tired and weak, short of breath, and chest pain. Moreover, sometimes bradycardia doesn't cause symptoms or complications. But for symptomatic bradycardia, it's an emergency. Now, since the patient is suffering from chest pain, an aspirin should be given if she's able to swallow without complications. However, aspirin is not administered for pain relief in the presence of chest pain. It is given for its antiplatelet properties, and numerous studies have proven that it prevents further clotting within minutes of being administered. The client will also need to be transported to the hospital ASAP. It's an emergency. Symptomatic bradycardia is an emergency. At the hospital, oxygen, external pacemaker, and atropine will be administered, as well as diagnostic testing will be conducted. Some diagnostic testing for chest pain are EKG, CAT scan, stress tests, coronary CAT, and blood tests such as troponin, CPK-MB, cholesterol and lipid panel, glucose testing, CBC, electrolytes, as well as liver and thyroid function. And this brings us to the end of our presentation.